So I have a lot of patients come to the office for evaluation looking to match their physical appearance with their gender identity. And unfortunately they go about it maybe in an unsafe manner. Perhaps they're afraid of doctors and surgeons being accepting of their gender identity, or perhaps they are looking for a less expensive but very risky way to go.
Our plastic surgery insider, Dr. J. Timothy Katzen, who's board certified, can attest to the dangers of botched surgeries by unlicensed practitioners.
We see all kinds of crazy things being injected. We've seen super glue, we've seen cement injected, tire sealant, all kinds of crazy stuff. Unfortunately, a lot of these patients go to maybe black market situations where a paramedical professional, or sometimes not even a medical professional, is performing these procedures of injecting typically silicone either into the breast typically, or sometimes even the buttocks, sometimes in the face, etc. But these are not a good idea. Raw silicone injections are not a good idea. It can cause pain, it can cause scar tissue, it can cause granulomas, which then in fact can cause cancer. So don't do it. It's crazy. Just don't do it. There are much better, safer ways to do it that are sanctioned by board-certified plastic surgeons. For breast reconstruction, we do breast implants, which are very safe. It's not the raw silicone injections. They're perfectly legal, FDA approved, so they're very, very safe. For the buttocks, there are a couple of different ways to augment the buttocks. You can put fat in the buttocks, you can do buttock implants, but I urge you not to do silicone into the breast or the buttocks or pretty much into any part of your body. So in this case, I have a trans patient who had unfortunately had silicone injected into her breast for gender identity. And this led to a whole host of problems. Initially, not so much, but then over the next couple of months and years, she developed a lot of pain in the breast because of the silicone injections, a lot of the redness in the skin due to the changes. This body reacts to the silicone, forms an inflammatory response, and the skin gets very red, angry, and tender. Sometimes the redness can last a long time and in fact tattoo the skin. So you wind up sometimes with permanent red marks. But to get rid of that, you need to get rid of the silicone and perhaps get rid of the inflammatory response of the skin to that silicone and to get rid of those red marks. So on this patient, I went in through an incision, removed all the raw silicone in that area. You can see the raw silicone. They're little beads or bobas, if you will, of silicone. They're little balls of silicone. Sometimes they're big, sometimes they're small. Sometimes it's very close to the skin, leading to that redness and that pain in that localized area of the breast. We remove all that silicone, and in this patient, I can safely put in an FDA-approved breast implant. Yeah, by the way, they're silicone, but they're FDA approved and they're in an envelope. They're in a wrapper. It's not the free silicone that's injected. Completely different substance. Okay? And this patient, just by getting rid of the silicone, she feels much better even the day after surgery by getting rid of that stuff. All that foreign body is gone, and now she has a much more appropriate breast, better shaped, less pain, and overall just looks much, much better.